Welcome to this edition of COVID Ethics Update, a service of the Center for Practical Bioethics. I'm Cindy Leyland and I work with the Center. Today I'm talking with Reverend Cynthia Carter Perrilliat. Cynthia is Executive Director and co-founder of the Alameda County Care Alliance in Oakland, California, and a member of our African American Advanced Care Planning and Palliative Care Network that's part of our effort to increase participation by African Americans in advanced care planning. We're working with faith communities to make that happen, and Cynthia is an excellent partner for that work. Today we're going to talk about the alliance that Cynthia co-founded and their particular approach to community engagement around advanced care planning and a tool that they have developed. But first of all, Cynthia, because we're friends, do I have permission to call you Cynthia?
You absolutely do, Cindy.
Thank you so very much. Pardon me. So, first of all, tell me about the approach that your alliance has taken in community engagement and how that has been successful in working on advanced care planning with the African American community.
Thank you for that, Cindy. And if I could, just let me start out by thanking you for the opportunity to have this wonderful conversation, and excited about always working with the Center for Bioethics and wonderful work that you all do, and just the joy of working on the Palliative Network. I call it the Pain Network. Dr. Pain, so integral to bringing us all together. Yes. So in response to your question, the approach of the ACCA, the Alameda County Alliance in Oakland, California. So it was really interesting. I have to be honest with you, many years of experience in working in marketing and education and training around palliative care and hospice care is my background. One of the things that we quickly discovered that when you want to talk about issues around advanced care planning, and this speaks not only to the African American community, Cindy, but also communities of color, the Latino communities, Asian American communities. Here in Northern California, we're quite diverse. One thing that was quickly made clear, and that is this. When you talk about the issues for communities of color, it's really important to address the disparities and inequities that exist from a very broad and holistic perspective. And so as an example, it's very challenging to talk to a Latino Catholic priest or an African American pastor or bishop around making decisions of end of life and death if you haven't built a relationship, if you haven't built a partnership that speaks to the holistic approach to living. And so we heard, first we asked the right questions, fortunately. We heard and clearly understood the responses and thought clearly about making an approach that was holistic in nature. And by that, I mean mind, body, and spirit. And so the efforts and the initiatives of the Alameda County Care Alliance, the number one, very relational in building relationships with pastors and faith leaders in Northern California, first and foremost. And then secondarily, understanding that if you really want to address the needs around serious chronic illnesses, advanced illnesses, obviously, end of life, you need to look at social needs, issues around housing and transportation, education, if you will, on many levels. You need to look at issues around caregivers and the fact that they provide so much support in communities and really aren't acknowledged appropriately, frankly. So our approach has been from a holistic nature, mind, body, and spirit, and I can speak more about our 5 cornerstone approach as we continue our discussion.
Excellent, thank you. We do know that there are many tools available to the general public to help us when we do advanced care planning. As you know, the Center's known for our Caring Conversations workbook, and the main part of that is to have that conversation. We know that naming someone to speak for us is really important because we might be in a car wreck and be rendered unconscious and not able to speak for ourselves. And hopefully we've named someone that could say, oh, she would want everything done for her, or she would want only, circumstances might predict that she would only want the minimal done for her. There are other tools that have been vetted and are very helpful. Those things include the Conversation Project. They have tools, the Go Wish game, the Hello game, death cafes. They're very popular, respecting choices. But the common denominator among all of those is the conversation. And those are all, you have to talk to somebody. You can't just do the tool, put it in your lockbox, and never talk to anybody about it. But why is it so important that these tools be tailored specifically to the African American community, or is it important?
Well, thank you for that question. Cindy, it's tremendously important in our studies and our research and the work that we do that we understand, once again, to embrace the holistic perspective to care. And what we mean by holistic or total care support is embracing individuals from a mind, a body, social, psychosocial, spiritual perspective. And within that context, culture is tremendously important. And so whether that is an African American and their culture, whether it's a German American and their culture, whether we're talking a Jewish individual and their culture, Latino, you name it, whoever the individual is, when we talk about person-centered care, and you hear a lot about that in the healthcare arena, we're really having to be very intentional and allow people space to know that who they are as a whole individual is indeed important. And so our approach to this work, predominantly our services and supports are to African Americans, although we have Caucasians and Indians, Asians, if you will, Latinos. We have a broad spectrum of individuals that receive our support through resources and empowerment, but we do serve heavily African American populations. And particularly, we serve a lot of low-income individuals. And so the approach that we've taken is one that says we honor you in whatever that means from your perspective. So your spirituality, if that's important, and whatever that means to you is what we're going to honor. Your background, your history, your ethnicity, all important. And we're going to be very interested in hearing you tell your story so that we can build, once again, this relationship so that, again, there is this sense of comfort, there's a sense of trust, as we know is a tremendously important issue when we talk about relationships and health and embracing this holistic approach to care. And so the approach that we've taken, and I mentioned earlier about our 5 cornerstones, advanced care planning is one of the 5 cornerstones. We provide support on a spiritual cornerstone, depending on what that means to the individual, or if it doesn't at all, that's perfectly fine. Social needs, caregiver support, and also on the medical side. And so when it comes to advanced care planning, with serving heavily African Americans in the faith-based context, because our support and our program is faith-based and community-based, and we make no bones about that because we, again, believe in that approach to holistic care. Individuals and their perspectives and being heard is tremendously important. So for example, advanced care planning, what does that mean to an African American elderly individual that, as an example, is living in a socially isolated scenario? In other words, all of their loved ones have passed on. They are, let's say, a church member, if you will, so they really rely on their faith community as community and, frankly, family to really establish a sense of comfort and trust Number one, we raise and train up care navigators. That's individuals that come from churches. Not all our care navigators come from churches, but most do. And so there's a level of understanding that's already inherent if that is a person of African American descent and of faith that they're visiting or that is a participant on our program. When it comes to the topic of advanced care planning, it's really important that we understand what is important to that individual. And so again, it's coming from a very personal perspective, it's coming from a relational perspective, and honoring their words and their wishes and not our own. And so I think you can see how that frame of thinking is applicable no matter what your cultural background, no matter what your spirituality or non-spirituality, if you will, might be, but it certainly gives the person that their voice and what they want really matters. And so that's the perspective of which we approach our work.
And so do you have a particular tool that reflects all of that? And can you tell us about that?
I'd be happy to. We have indeed developed a toolkit and a specific tool around the faith-based community and African American focused advanced care planning. And we took a lot of input and insights from focus groups with our community care navigators to really understand what are the important issues and what needed to be included. And so what we've done, Cindy, is come up with a care planning workbook, the ACCA Care Planning Workbook. And this workbook basically has 3 parts to it. The first part focuses on thinking about what it is that's important to you as an individual. It goes back to that broad, very important personal issue. And then we talk about planning as the next step. So what does planning for advanced care look like? Questions around what is a ventilator? What is a presser? What does a dialysis equipment look like? And why might that be an important decision or something that I need to consider in making decisions around advanced directives? And then finally, documenting what do I want? Who do I want to speak for me in the event that I cannot speak for myself? So this 3-part planning workbook, if you will, that we've developed takes into consideration all those important factors that I spoke about earlier. What's important to the individual, which embraces their holistic perspective about their life, whatever that means to them. Then planning about what they would want in particular. And then finally, documenting that information.
That sounds marvelous. Is that available to the public, or is that something that they have to work with your alliance to access?
So thank you for asking that question. Presently, we're working the workbook amongst our participants that are part of the Care Alliance program. What we fully expect to do through our relationship with the African American Palliative Network, Cindy, is to be able to provide this workbook so that the broader national community can also have access to it. So we look forward to having those conversations about making that happen as well. And we see ourselves really further engaging this model that we're really excited about the level of success we've had in our community to expand and spread to other parts of the country. So I think this will be an incredible tool to help really share amongst the communities abroad.
So we're all Johnny Appleseeds, aren't we?
I got you. Very much so.
Before we finish, I'd like to pick your brain a little bit about the frightening data that we hear that Black and Brown people are disproportionately affected by COVID-19. It's disheartening, it's frightening, and it's sad. Can you talk to me about that? I mean, it's clear that this is tied to pre-existing social inequities, and we can wring our hands and say, ain't it awful? But help me wrap my head around this and move beyond just wringing my hands about it.
What an important question you raised, Cindy. And indeed, we are in unprecedented, challenging times, just trying to, first of all, as a broad community, and that's everyone in the community, what it is we're dealing with, and certainly why communities of color, particularly Blacks and Browns, are so disproportionately affected by COVID-19, I think is a tremendously important question. I think I'd start to respond to that question by sharing a very recent experience that a physician friend of mine that literally helps other physicians in training and developing language around how to talk to their patients. This wonderful doctor reached out to me and said that there is a very interesting thing happening in the state and region that he lives in, which happens to be in the upper northwestern part of the country, the state of Washington in particular, that physicians, particularly white physicians, are asking the question, what's going on here? So many of the folks that are coming to our hospital and to ERs are people of African American descent, while their community comprises only about a 7% rate, if you will, of African Americans. They're seeing as high as 30% of those individuals that are coming to their hospital are African American with the COVID-19 symptoms, and unfortunately, the COVID virus itself. And so we began to develop very deep conversations around how we could work together to provide physicians, particularly white physicians and non-Black physicians, with language so that they could literally develop more of a, again, relationship, more of an understanding, more of a mutuality of humanness, if you will, so that their African American patients that are being challenged under COVID-19 could have a sense of being, number one, seen, and number two, heard. It really all goes back to respect. And so we know that there are unprecedented health inequities and health disparities that people of color experience in this country. COVID certainly has highlighted that. You probably heard the saying that when America gets a cold, the African American community gets the flu. It is exacerbated. And underneath all of that, frankly, Cindy, are what we often in the health world refer to as social determinants of health. What does that mean? It speaks to the issues around poverty, unemployment that communities of color, and particularly African American communities and Latino communities face. It speaks to issues around food deserts within those communities where there's not adequate vegetables and fruits available. It speaks to issues around, I talked a little bit about unemployment issues, but lack of insurance, inadequate insurance. I mean, it goes on and on and on. Living in toxic environments. Think about Flint, Michigan as an example. And that's just one of many. So it begins to paint the picture that these serious chronic diseases that people of color are experiencing and have experienced in this country for decades, this is not a new issue, is rising to the surface very clearly because of all of these issues that, when you put it all together, ultimately are very stressful issues that then and again ultimately affect health. And so we're talking about the physical health of an individual. That's why we see these incredible statistics that African Americans and people of color have in all the main disease modalities. You talk about hypertension, you talk about heart CHF, you talk about COPD, the list goes on and on. You begin to really get the picture in terms of why African Americans and communities of color are disproportionately affected by COVID, because all the things I just stated. Immune systems are affected because of the high level of stress that they're dealing with all of those particular determinants. So it is a big deal. And it is something that I have to say in many ways is very much in some ways shameful. But yet, on the other hand, and it's shameful because we have not faced those issues collectively as a nation. I think there are pockets within the country that are really trying to address these issues prior to COVID, but I think now it's in all of our faces. And my question is that how do we begin to really see what's happening, hear what's happening, and all of us recognize that there is an important role that we can play in helping to change the trajectory of these challenges, particularly for people of color.
And hopefully the work that you've done with that doctor that you mentioned, building those relationships, encouraging them, teaching them how to build those relationships, build on the mutuality, will extend beyond this immediate crisis and have a life beyond this, so that we really can address the underlying issues of institutionalized racism that have been laid bare. And we have to address that. We cannot go back to the way that things were before this, because you can't get different results using what you did before.
Old methods.
We cannot do that. Cynthia, thank you so very much. I like to end my interviews by asking, what has made you smile today?
What has made me smile today? Cindy, I am a person that tries to live my life in and through the lens of gratitude. And I am grateful to have been able to open my eyes today, to be able to breathe on my own. As you can imagine, working in this field, we see people having health changes rapidly and often. And so being able to breathe on my own, being able to have this conversation, all of these things, being able to share about our work and our joint work with the center brings a smile to my face, because it's an opportunity to hopefully bring some hope and light to someone else. And so for that, I thank you as well.
Thank you so much, Cynthia. And thank you for joining us for this edition of COVID Ethics Update, a service of the Center for Practical Bioethics. If you have questions, ideas, comments, or suggestions for future editions, we ask that you email us at covid@practicalbioethics.org. Be sure to subscribe to the Center's YouTube channel and sign up to receive our COVID ethics updates in your inbox at our website, practicalbioethics.org. Thanks again for joining us. Stay safe and be well.